Good afternoon, everybody. Thank you for joining me today. I'm announcing that we have our first positive test for COVID-19 in a man in his 40s from Barrie who tested positive on March the had developed symptomatology and had tests that came back from March the 8th and had been traveling through Germany and Spain. Since identifying as being ill and being assessed at Royal Victoria Hospital, he's been kept under home isolation. And at this point in time, we are investigating the situation more thoroughly, looking at potential contacts that he may have had in the community as well as in the home, in order to identify further steps that should be taken to protect the community from the possibility of transmission. I don't have further detailed information about that investigation, but we will get back to you with more information as we have it. What I would like to say is that it's important for people at this time to be aware of COVID as it has certainly been spreading around the world, and we've had more cases of it right here in Ontario. Although this is our first case here, this has been anticipated because of the unfolding of this pandemic, and that people should be aware of the potential for transmission and exercise practices to protect themselves, reduce the likelihood that in the future they could become a case. This includes practicing good hand hygiene, so frequent hand washing or use of alcohol gel. The possibility exists in the future for this to transmit readily in our community. We don't have evidence of that happening right now, but we have had some evidence of that happening potentially in the city of Toronto with a case that was reported out of Sudbury, and so the potential exists for it to come here, and with that people need to be aware that there are things that they need to do to reduce their risk. So hand washing would be key, but I think at this point it'd be helpful for people to think about what we call social distancing as well, being aware of people in their immediate personal space, and when they're out in the public, keeping a distance of 1 to 2 meters from other individuals, certainly being aware if others are ill or coughing and keeping a distance. Certainly people who are traveling from other countries who come home, if they develop symptoms, we would certainly advise that they stay home, isolate themselves, and seek medical advice from us or from their healthcare provider or from telehealth. We would want people, of course, to be practicing cough hygiene as well, coughing into their hands or sleeve, and back to the hand washing as being absolutely critical. At this point, I'd be happy to take questions with regards to this situation.
Mike from CTV Barrie. How long was this individual back in Barrie after returning from Spain and Germany? What symptoms did this individual have? Does this person live by himself? Are those other people in self-isolation as well?
So this person does have family members, and we are investigating the potential for them, how they are. So he does not live alone. He's been back for less than a week. Not going to speak specifically about the dates. He's been abiding by home isolation since seeking assessment at RVH.
Symptoms?
His symptoms consist of the typical symptoms of COVID, which is cough, fever, sore throat, generally unwell.
Do we have any concerns with March break coming up and the amount of travel that people will be doing?
I think that's a very important question. We're certainly wanting to take measures to reduce the likelihood that this is going to spread in our community. One of the ways is to have people aware of the potential for them to become cases if they travel. There's now many countries in which this is transmitting in the community, including the United States. People need to be aware of that and make decisions very carefully about if they're actually going to proceed with their travel. And if they do proceed with their travel, I think they need to be once again, practicing those social distancing practices that I cited before, keeping their distance from others, avoiding crowds, and certainly avoiding ill individuals. And if upon their return they become ill, to isolate themselves and seek medical attention, including contacting us.
Should people be going into quarantine when they come back, or should they be going to a hospital or their doctor's office to confirm if they have COVID?
If people return and develop symptoms, they should immediately put themselves in home isolation and should then seek contact with their healthcare provider, with us, or with telehealth as they go forward then to be assessed. After, they should contact the emergency department or their family practitioner before going so that they're prepared to receive them, and should go in a way that doesn't expose to others. So they shouldn't be taking public transit. If they have a mask, they could apply it while they're traveling, preferably in their own vehicle, preferably alone. As for the need to quarantine or isolate yourself without symptoms, at this point in time, we're only advising that for people that have come back from Iran or Hubei province. That may change over time. This is certainly dynamic. It's unfolding before our eyes.
At what point are we asking people to not go into public spaces? I know we're saying be careful, but malls, sporting events, when does that come about, do you think?
We haven't arrived at that yet. We don't have evidence of transmission happening in our communities, but we're certainly looking to the potential for that in the not distant future as this unfolds. And we would advise people to be monitoring the media, monitoring our messages for that. It may very well come in the not too distant future.
And you know, you say you don't have the facts right now, but when will we know this gentleman's activity in the community, or will we know that?
We are questioning that right now, today, and when we clarify what would be helpful with regards to the public knowing where this individual had been, we will come forward with that information and in a timely way.
Is the risk to the rest of Simcoe-Muskoka still low?
I would say that we don't have evidence that it's transmitting in this community yet. I would say that people need to monitor the situation closely because it may change very quickly. And so I think I hesitate to say low now because of the potential for it to change.
Where should people go for precise and accurate information?
I would certainly advise they could come to our website. They could go to Health Canada. They could go to the Ministry of Health websites. And there are linkages to other useful resources there, including to the World Health Organization.
Was it only confirmed today the individual had COVID-19, or was this known immediately? What was the process there?
We were informed in the early hours of the day today about the positive test result.
It was presumptive before this? When? Monday?
We had the test result today. They've changed their process now so that there isn't a status called presumptive. They're relying on the test.
And can we ask for more details of what the test is? Blood test, swab of the throat, what kind of test?
It is a swab of the throat and the back of the nose, the nasopharynx.
Hi, I'm Laura from XFM. Of course, the media, we've been getting a lot of accusations of fear-mongering whenever we share a factual story like this one. I anticipate there's going to be a lot of responses. What is your message to residents about what they should do, if they should be afraid, what they could do to prevent this from spreading even more? Any advice you have for residents right now?
My advice is at this point in time, we don't have evidence it's spreading here yet, but that could change in the near future, that they need to follow the media closely about our messaging around that, and that they otherwise need to be practicing those good infection control practices that we've been advising all along, even before this, of course. So if you are ill, you need to isolate yourself so as not to spread it to others. And if you've had a relevant exposure, like the travel history, you need to be seeking attention from us or from your healthcare provider, from telehealth. that I would think at this point in time people probably need to be thinking about crowds and some social distancing, awareness that a 2-meter separation eliminates the risk of being able to receive this from another individual. To practice a hand hygiene, so cleaning your hands regularly is one of the most effective things we can do. And to be aware of others. If there are others who are ill with a cough, it's good, all the more so, to keep your distance from that person.
That was going to be my follow-up question, especially when we're in the midst of flu and cold season. How can people differentiate between having a cough and possibly needing to go tested?
So certainly there are other viruses circulating at this time of year. This is a time of year in which we have influenza and other viruses on the go. And the practices that I described would be helpful for managing them as well. We don't have evidence of it circulating in the community right now, so I think people should be more aware of influenza as something else, and that for that matter they can get a vaccine for influenza. But they should also be paying close attention to the media, because we will be notifying the community if we have evidence that it's actually, that the COVID is actually spreading in our community. Other than knowing it because of our testing and our messaging, you really can't tell it apart just by its clinical presentation from the other viruses that are common.
What do we know about how the virus spreads now? Because I know community transmission, is it on surfaces? Is it through droplets? Like, what do we know about how COVID-19 spreads?
So COVID-19 is spread by droplet. Primarily respiratory cough. They would produce droplets that then settle out in the environment within 1 to 2 meters. It doesn't carry farther than that. It can contaminate surfaces, and so it's important for people to exercise a hand washing and avoidance of facial touching as well. But the greatest vulnerability would be in the immediate environment of somebody that has it and is coughing.
Do we know, I apologize if you mentioned it, the gentleman that has this, does he have any underlying health issues other than this obvious one? Is there anything else wrong with him?
So this person, I would say, is not at a high risk of getting complications with COVID and some other viruses such as influenza. People who are older, 60s or above, and have pre-existing medical conditions, heart disease or diabetes, for example, are much more likely to develop serious complications or to die from it. So I would say in this case, we have an individual who's not at high risk.
He's going to remain in quarantine, self-isolation until the 23rd?
The protocol now requires, with people who are tested positive, to remain in isolation until they've had 2 negative tests for the virus.
When will we be tested?
We would wait until he recovers and then follow up. And this would be done in close conjunction with his attending physician. We're not actually the attending physicians providing his care. We're responsible for protecting the broad community.
Right. Where are people being tested? Like, so this gentleman attended RVH.
Mm-hmm.
Like, that's where he was tested? Or?
Yes. And RVH certainly practiced top quality infection control practices with this, as they do with all such encounters, to protect the hospital environment and everybody in it. It is right now necessary that those who do this testing have the proper personal protective equipment to avoid becoming exposed themselves or contaminating the healthcare environment. So it's been primarily emergency departments that have been doing this. We are looking at the potential for establishing other locations in the community, assessment centers as we call them, primary care practices that have taken upon themselves to have the equipment to be able to provide that service, but at this point in time they're not in operation.
Did he go alone to RVH?
I actually don't have specific information about that. I do know that there weren't others that were exposed through his travel.
Was he asymptomatic when he returned?
The individual developed symptoms after returning from his travels.
Which is familiar with what the situation is in Spain. Are you? Like, what is the situation?
Spain is one of the European countries that does have a significant number of cases and some evidence of community transmission. It's certainly not nearly as high as Italy, which is got the second highest number of cases in the world right now and still had a rapid increase in cases, a high mortality rate.
And now that we have our first case, which we anticipated, obviously sooner than later, what are the steps now? What are we should do moving forward?
So as a health unit, we've been working for a long time now to respond to the situation, to work in concert with our healthcare partners to respond to the situation, to provide the information and guidance from the province around the assessment and management of potential cases and contacts. We continue to put that information out. We've been receiving large numbers of calls from the public with inquiries about the situation or about their potential exposure or what they should do, and we'll continue to do that. And in fact, we've had to increase the number of people on our lines and extend our hours in anticipation of what will come from today's announcement. We've liaised with leaders in healthcare agencies on the question of setting up assessment centers and have as many as 7 that may be able to be up in operation when needed, provided they can overcome certain barriers such as having sufficient personal protective equipment and also having the authorization of the province to commence operation given that the province is proceeding in that way. And we're also having dialogue right now with healthcare agencies and municipalities and other agencies around business continuity planning, looking ahead to how they would manage to operate well when we have circulating virus in the community and it's having its impacts on absenteeism or staff potentially being in quarantine or disruptions to services. So we're looking ahead as well and prompting our communities to be ready for that. We've also positioned to the public at large that they should be thinking in terms of their own preparedness. We've advised that people be able to stay home for as long as 14 days, if that's the period of time that would be required for quarantine, and so that means that they should have sufficient supplies at home to be able to do that and have arrangements with family or friends to be able to provide the kind of support that they would need to go through that. So we're quite active on the whole thing.
Where are these 7 centers?
So at this point I wouldn't want to name them because they haven't come into operation yet.
So what would you say, even though most people are being very realistic about the pandemic, we've been through stuff like this before, what would you say to the few, though, that are extremely terrified, very concerned, who are rushing out and buying as many supplies as they can, as well as, the elderly and other people who have weakened immune systems? What is your message right now? They're hearing this first case in Simcoe County. They're terrified. What would you say to them?
Well, we want to inform people, not alarm them. And I would want people to take a measured approach to this. Certainly they should look at their home environment and say, what do I need to be ready if I were quarantined? And build up their stocks of food, medications that they would need for that. Do it up in a more gradual way. I do understand that there's been some shortages of hand sanitizer, for example, that have materialized out of this. But I would want people to take a more measured approach in being prepared for this and also become really aware of the infection control practices that I've advised and to pay attention to the media. And if you belong to a vulnerable group such as being elderly, it's all the more so that you need to be vigilant about infection control, about the social distancing, about requesting that if anyone comes to visit you that they not do so if they're not well. I think right now we've supported the province in advising our long-term care facilities to be vigilant about individuals who are unwell not coming into the facility. There has been an outbreak in British Columbia in a long-term care facility of COVID, and so it's all the more important for those that are in those homes to be protected. So would want people to take a measured approach.
But don't panic.
Panic is not going to be helpful, I'm afraid.
What do you think of the global reaction? Banning flights from Europe to the U.S. or shutting down Italy. These these seem like sort of drastic approaches here in Canada, where we have one case for 57. What do you think of those approaches that other jurisdictions have taken?
Well, I would very much want us to be positioned so that we wouldn't have to take such drastic measures and to be proactive. And so far, I think we've done fairly well. We've only had very limited evidence of community transmission. We've had this containment approach of having the whole system primed and on the alert for cases and isolating and following up with them and their contacts to prevent it from spreading in the community. So I think we need to continue to be proactive in that way. And if we're getting to the point where it means positioning that people do the social distancing and that we consider carefully large events and whether they should be canceled to prevent such spread, that we need to look at that. We need to look at it earlier rather than waiting to be caught in a situation where we have exponential growth happening and have our hospitals, ICUs pressed and overwhelmed. So I think we need to keep in the course we're going. And I certainly have nothing but sympathy for places like Italy that unfortunately have found themselves to be very much caught in exponential growth and are now having to put in place some very severe measures. I would want that we could avoid such severe measures by being proactive.
With Canada being hit with SARS a few years back so hard, how did SARS prepare us for this? And is that why we're so prepared, it seems?
That's a superb question. We cite it quite a bit, I've noted. And I think there's some truth to that we went through a harsh experience in Ontario. China went through a harsh experience and we went through a harsh experience, and otherwise it was far less dramatic than what we're seeing now with COVID around the world. And so perhaps it really did prime us. It certainly primed a very serious look at the public health system with reviews in Canada and in Ontario, and with a serious investment in public health. The development of Public Health Ontario is an entire agency to provide us with guidance and support came directly out of that. Same with the Public Health Agency of Canada. And so I think we did learn some lessons from it, and I think so far they're bearing fruit with regards to how well we're doing. And I think it really speaks to the importance of that kind of investment and keeping up that kind of investment in our public health system and in our healthcare system.
Your last board meeting mentioned strains on the department that deals with infectious diseases. And, is that related to this situation, or is it just sort of coincidence? Or can you talk about
it was actually a longer term trend over a number of years, and it was related to fiscal restraint that we've experienced over the last few years, essentially having in fact our budget really shrinking. It was frozen, but that means shrinking in terms of resources, and how we've had to determine where to cut back and where not. We did not cut back in that area, but we weren't able to enhance it either. And meanwhile, the population has grown, and the issues that we've faced in infection control and in communicable disease have grown over time. So it's pressed, and our way of responding to that now is to reallocate resources from other programs in the health unit to that area to make sure we can respond well to this. I would be happy to take questions later, and I anticipate that they will come. Certainly when we come back with more information, I would anticipate more and be happy to take future interviews. Thank you.
Thank you.
Okay, thank you everyone for coming, and you'll hear from us at a time when we have more information. Thank you.